Well, welcome to this Meet the Trainers Google Hangout. This is one of a series of these programs we've been doing, and they have proved to be an amazing store of rich experience in how to use and apply EFT to common problems. So I'd encourage you to check out the whole series, play them at your leisure, but use them to solve these really common problems that we address as we have a theme for each of these calls. We've also had a lot of fun in the hour leading up to this call. We've been preparing and getting our microphones and lighting and the rest of our appearance right, and it's been so much fun. If we have half as much fun on the call as we had leading up to the call, then it'll be a really good call indeed. So it's been a lot of fun sharing with these precious friends who are also EFTUniverse trainers. So I am so privileged to have on the call with us tonight Claudia Schecter. She is a coach in Montreal, Canada, and I can tell you I read the evaluations that you write, that you, all of our wonderful EFT community, write when you've done an EFT workshop, and the responses back from her workshops are just so powerful that people have such fantastic experiences when they study with Claudia, and if you take a workshop with her, you'll know that that's really an amazing experience and a really powerful experience and a powerful shift in you, as well as a grounded, solid, effective way to learn EFT. Our second guest tonight is Dr. Craig Weiner. He is a chiropractor, and he's also married to Alina Frank, one of our other trainers. They often train together. I also read their responses that come back from their workshops, and they are so wonderful. I just had an occasion to email them back a few of the pieces of feedback that they'd gotten and recommend they put those on their website because they were so powerful from you, our community, our members who are taking these trainings and unlocking the full power of clinical EFT as you do that. So welcome, 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 Craig and Claudia.
Claudia, ladies first.
Okay.
Well, it's wonderful to be here. I'll say hello. I didn't hear you, Claudia, but just thank you for that very kind introduction, Dawson, and of course, teaching for EFTUniverse and teaching students EFT is just, it's fun, it's joyful, it's fascinating, I love it, and so it's pleasing to hear that people appreciate and get a lot out of that. So thank you for that very kind introduction. That was very nice.
It's joy. So our topic today, our theme, is going to be physical symptoms and pain, tapping for physical symptoms and pain, and you both have a huge amount of experience in this. I think let's begin, if you wouldn't mind. Perhaps Claudia, you can go first. I'd love to have you just present maybe one or two cases of people you've had who've been in physical pain or had some kind of symptom that bothered them, and how you applied EFT to that problem. So we should both talk about the principles of using EFT for physical problems during the course of the call, but also make sure we share how we've done this with actual clients and the kinds of shifts they had in their bodies and their sensations as they applied EFT this way. So, Claudia, maybe just kick off with one or two cases, examples you've had of people who've applied EFT for physical symptoms or pain.
Absolutely, Dawson. Thank you very much. Actually, physical symptoms were one of the reasons I got into EFT because I'm a naturopath, and I always, for the past 25 years, I've always worked a lot with chronic disease. And when somebody came, let's say 2 clients came in with the same physical symptom, and I put them on the same naturopathic protocol, one person got better and the other person didn't. So for me, it was pretty clear that there must be some limiting beliefs behind it, or some kind of emotion, or some kind of trauma. And that's why I started learning EFT way back in 1998. And my results have just been incredible. And one of the stories, it's a beautiful story, actually happened in one of my last trainings. And I was, when I teach my students, I always give demonstration, and we were working on doing EFT for physical symptoms. And this lady had 8 years of severe knee pain. She could barely walk. She was limping up, and her doctor, her husband, is an MD, so he took her everywhere. She had all kinds of medical help and so on. And so we started tapping, and she actually, which is important, she was Italian. But so we first started tapping in English, but then I asked her to repeat the words in Italian, and that is actually something that is very important. And there is an article I wrote on EFTU, tapping in your mother tongue, which maybe people should look at one point. But anyway, so she repeated the words in English, in Italian, and it led back, and it led back, and it led back. And it brought us to an incident when she was 11 years old, where she wanted to eat chicken wings. Now everybody would say, how can chicken wings have something to do with knee pain? But anyway, so we were working with this incident around the chicken wings, and I mean, privacy issues don't allow me to really explain everything. But at the end, when we cleared the trauma of the chicken wings, she got up from the chair and her knee pain was gone. Mm. So it was just one intense trauma, a family trauma that was lodged in her knee, and it was gone. And she's now coming back for level 2 next week. This happened in September 2013, and the knee is gone, is perfect since then, after 8 years of chronic pain.
And it went away, and it stayed gone.
She got up without pain. She couldn't believe it. And it never came back. It was just this one severe trauma.
Did she make any connections in her mind between the incident and the pain?
Well, we started kind of, you know, when we were looking at the knee, we thought of moving forward, and you know, like, and that kind of, we just followed that thread back, and then it led us to, and especially when she started tapping in Italian, because it's a different, she picked up this trauma in Italian, which is a different frequency than English, and then she even went into her dialect, the dialect she spoke at home. And so we followed that thread back and back and back, and then it led us to this one specific event. We cleared it, and the knee pain was gone.
Hmm. Hmm. What an amazing story! Wow. And
yes.
You know that you realize too that even if she'd gone to the best specialist in joint issues, if she'd had the best medical care, if she'd had a really appropriate mix of medication, none of those things would really have addressed that until you find the emotional roots.
Yes.
You are going to be attempting with inappropriate means to work on what's really an emotional issue. So I'm so struck by the fact that we need both appropriate medication, and we need really good medical care, and we need to address the emotional issues. And if you have both of those things, you have the best of all possible worlds. But if you are trying to address emotional issues medically or medical issues emotionally, you're only giving yourself half of the equation. And
absolutely.
Yeah.
Absolutely. I also, I'm specialized in Lyme disease, and I work very closely with one of the biggest Lyme literate doctors in North America, and we do exactly that. Because the first thing, and that is very important for everybody who listens to the call, if you have a physical issue, don't just start tapping. Do see a doctor, you know, see what's below us, and then take it from both sides. Okay, so I really like to work with doctors and have a diagnosis, but go to the emotional components, contributors of the pain, and also of the chronic sickness.
Yes, yeah, absolutely. Wow, what a wonderful story. Thank you so much for sharing that. That's just a great example.
Thank you.
So Craig, please share with us an example or two from your practice as well.
You know, it's funny. I had a patient today that I was going to share about, but I think one that's actually a little more fun is how I actually started understanding the mind-body personally connection. And you can imagine being a chiropractor for many years that I know at least a little bit of back pain. Yeah. So Alina makes me tell this story in every training, and I'm not quite as embarrassed about it anymore, but it's still a good one. So years and years ago, when I was first getting introduced to EFT through Alina, I was going through a period of my life where I was clearing up a property that I owned, getting ready for sale, and I'd been working out in the yard for most of the day and doing some heavy labor, and I strained my back, and I came in limping and bent over, and so I was heading to get my ice pack and rest and do all the things that I would tell any patient to do. And she looked at me and said, "Do you want me to tap on you?" And I said, "Well, this isn't an emotional thing; it's a physical thing."
No, it's never an emotional thing. Pretty physical.
You can imagine that she backed right off on that one. So she said, "Really, you're not going to even let me try?" And of course, at that point, you know, we were still fairly new in our relationship, and I said, "Fine, you know what? Give it a try. Give it your best shot." But I know what I did. I know I was digging in the yard. I know what ligament I strained, you know, and I gave all that kind of stuff. So as we started to tap, it was like, no, you know, even though I overdid it in the yard, and even though I was working too hard, and even though I probably didn't listen to my body, even though I had to be working all day because I'm getting this property ready for sale, and even though I'm the only one that's doing all this hard work because I'm going through a divorce and I'm having to get all this work down myself, and I'm having to get ready, and I'm having to get the property, and I'm mad that I'm having to be doing all this myself. And as I proceeded to find that there was a little bit of resentment and anger through the part that I was doing at that time, there was a tappable issue there, apparently. And as we proceeded to tap on it and the pain basically disappeared, afterwards I was like, oh, I am in such trouble now. What am I going to do with my patients on Monday now? So, you know, I use that story because even behind every physical issue, there's often an emotional, stressful one, either involved, underneath, as a result of. So whenever I'm talking to my patients about their physical pain or their physical symptoms, I'm always listening for what that window of hearing is for them, that they can begin to engage in a mind-body conversation. Yeah, because some people were just in a car accident, so that's not emotional, or they slipped down some stairs, and that's not stress, it's they fell. And so I think that after 20-something years of being in practice with patients, I started to develop a listening for what's that window in for me to be able to help them make that connection. And I think that's part of the art of what we're all doing as practitioners.
I wish I was a fly on the wall and could watch one of your sessions and see how you blend chiropractic with EFT. I go to a chiropractor who is really a good chiropractor and talented, and but it's just straight chiropractic, you know. So I'm just really curious. How do you? What does the session look like when you're going to bring in both techniques?
Well, you know, this is something that I'm fascinated by in exploring with all different kinds of healthcare practitioners. When a client or patient comes to them, not thinking they're coming for EFT. Yes, so in other words, they're coming for whether it be a dentist or a physical therapist or a chiropractor or a massage therapist. You know, other than coming to an EFT coach, you have to be responsive to why they came in, right? And so what I would say for me typically is I'm listening in a first session for how much I intuitively sense might be stress emotionally related. And it's all about rapport, and it's all about connection. So if I kind of peel off into an emotional discussion too quickly, I'm going to lose rapport with the patient. But if I say, you know what, there's just been a lot of stress at work, or there are ways that they're going to word something more than the physical. And, you know, whether it's a metaphor, whether they're talking about the stress in their life, always in my history, I'm also asking not just only how it happened, but what's been going on in their life recently, Has there been a lot of stress or changes in their life in the last 6 months or a year? So I'm always listening and asking for what I think might be EFT relevant questions. What will often happen when I feel that the opening is there, if not the first visit, the second or the third, when they're stalling, maybe out physically. So in other words, I'm working physically first, because that's why they come to me. But if I see things could go faster, or if I see that I really think that there's an emotional component, then I'll say, you know what? I'll start having a conversation about stress, and then somehow I'll introduce it. I may lend them one of the EFT books. I may have a conversation about mind-body and this EFT tapping, but we'll talk more about it next time, or have them watch something online that we've created. So I'm always gentle in that first introduction to it. The next time that we'll get together, I'll show them maybe a beginning pain. You know, if we're working with pain, we'll just maybe be tapping just on the symptom, or maybe an emotion that's as a result of the symptom. So if they start to then see, wow, I can really start to have some control over this and affect this, then we'll set up a time and session for a longer session. So as a chiropractor, I'm kind of inching my way in. I don't just see a patient the first time and say, let's set up a tapping session. So for me, there's an art to that.
Yeah, that makes perfect sense. Yeah, not lose the rapport, to treat their physical pain as what they said is initially, but then look for emotional contributors and then introduce to them gradually the whole notion of addressing those, and then bring tapping in that way. Very nice.
For me, I'm always interested in how other practitioners, I eventually see an article or book or something to just continue to show different ways of integration. So unfortunately, a lot of practitioners see it all or nothing, that I've got to set up an all or nothing, hour-long, 90-minute long, whatever session. And we've seen studies like the dental study that he did a 5 or 10-minute intervention. So I'd like to think that there are many, many variations about how we can introduce people to EFT while still keeping in rapport and expanding, teaching them, and also different professions have different limitations as far as what they can do, whether it's a self-help technique and they're just demonstrating, whether they can do tapping with the person. So there are a lot of variations. I just know what I've developed over time.
Yeah, very good. I'm just curious, Claudia, do you still practice naturopathy?
Barely.
Okay.
Barely. The EFT has overtaken the naturopathic work, and my success is just with tapping, going to traumas, going to limiting beliefs around sickness, going to limiting beliefs around pain, is so much more powerful than handing out supplements. So I barely do that. It's very, very rare. I may put somebody on a diet, but I really notice, like, if somebody comes in and the doctor said, oh, you have to live with this pain for the rest of your life, if we don't address that limiting belief, they will live with the pain for the rest of their life. So it's very important. When somebody comes in, I usually ask them, when did the pain first start? And 99% they just had a trauma before that. And then about the diagnosis, we work with the prognosis. And when all that is cleared, I see incredible changes with my clients.
What are some of the other questions you ask, Claudia? So one really good one is, when did this pain first start?
Absolutely.
And you then often find there is a trauma there that that happened right around the time of the pain, like Craig's very immediate story about cleaning the yard. What other questions do you ask? How else do you probe pain clients?
So then let's go. Then in my experience, in acute pain, it's a little bit different, but in chronic pain, I go, when did it first start? And then we go into that trauma, and then I ask them, usually I say, do you feel it in your body? And then I ask them to follow that feeling back. And very often, most of the time actually, they then connect with prior experiences, with prior events in their life. Very often they go back to the first 6 years of life, actually.
Yes.
And then we need to work with those traumas. But that takes some time. That is often done. Sometimes it happens in the first session, but sometimes we need 2 or 3 sessions for that.
Yes. Oh, I can
But
imagine
then I
that.
also explain my clients, like a chronic disease did not just happen overnight. It's like unpeeling the onion. We have to slowly work backwards and release all the traumas or all the events with a similar energy all the way back to early childhood.
Yeah, those problems do take a while to form in the body. One of the most amazing studies I read a few years back, published in the Journal of the American Medical Association, was actually they had 2 studies of cancer published in the same issue, and one showed that the average cancer is growing for 12 years before it's detected. So that's a long time. So the person, the cancer patient, has had this cancer progressing for over a decade before detection.
Absolutely.
The other study, which no one really linked these 2 studies together, but I write about them in the Genie in Your Genes, is that in the same issue of JAMA, they had a study showing that the body naturally takes care of 30% of cancerous tumors. The body so cancerous tumors form in our bodies. Of course, there are cancer cells happening all the time. Our body is really adept at handling them, and even if they become an actual tumor, form a tumorous lump, tumorous mass, the body actually naturally, without any kind of external treatment at all, 30% of those are just dissolved by the body in the natural course of our self-healing. So that to me, if you put those 2 studies together, says, okay, 12 years, for 12 years, you have this possibility of shifting that tumor, and your body, the possibility that your body can, at least a 30% possibility, your body can disassemble that tumor, pull it apart, pick it apart, and disassemble it into its component molecules without needing to necessarily manifest.
Absolutely, yeah.
Yeah. Craig, what are some of the other questions you ask? You mentioned you also do look for emotional issues. How would you do that?
Sure. I think most powerful, just agreeing with Claudia, is onset questions. Because, and also people, when they have physical pain, are often looked to what happened that morning or that day before. Yeah, and so being able to open that window to other things that were happening, well, how about in the last month or 3 months or 6 months or even up to a year? Have there been big changes? Because people really minimize their traumas, and people minimize the stressors many times, more often than not. So I try to open it at the idea of stressful and traumatic events being even bigger than what they might first think, because they think other people have traumas. I just have, little stressful things. I don't want to make a big deal out of it. Other people have it worse than I do. So one is just opening that up. Then certainly I always ask about past times that they may have had that, so they may not be relating it, but oh yeah, well I had this back when I was going through a job change. So I ask about past times that particular area of pain may have happened. Of course, as we all know when we do a VFT, that listening to the words of a recipient is worth its weight in gold. And so when we ask open-ended questions, asking about, well, what does that feel like? Of course, always listening for powerful metaphors. It feels like somebody stabbed me in the back. It feels like I have the weight of the world on my shoulders. And we all know to do that, and they're so powerful and meaningful because words and symbols tap the subconscious and give us so much information. But beyond that, I also am really looking for what are the things that are limited by their pain. And they may go right to, I can't lift my grandchild anymore. I can't, I see kindness, but basically it starts to speak to I can't be so intimate with my partner like I was before, or a variety of issues that start to speak about at least, if not causative factors, at least certainly the emotions that are happening as a result of the pain. And that's often, for me, what I find a really good entryway to a new person to tapping.
Yeah.
We're being cautious about, at least I am being cautious about not looking overly psychotherapeutic and going too quickly back to childhood issues, of course. So I will often start with not just tapping on the physical pain itself, which is kind of the easiest and most superficial level, but then starting to work on what are the feelings associated with the limitations of not being able to go to work, of the fear of loss of income, of not being able to have joy with their children, all those different issues. And of course, also, like Claudia was saying, is when you start to ask about the activities, they may get very physical, like, I can't seem to step forward, I feel like I'm always walking backwards, I feel like I'm scared of falling on my face. And there are a variety of physical metaphors and symbols that they'll use that will describe the activities that are limited in their life, or their fears that are happening in their life that are bigger than just the physical descriptors.
Yes, those are really good ones, and if you're listening closely, you'll start to pick up on those. I know sometimes if people say to me, I have a pain in my neck, I'll ask, so who's the pain in your neck? Oh, your ex-husband.
Yeah, always. Yeah.
If you're a chiropractor, you ask who's the pain in your sacroiliac joint, but they get the idea.
Yes, yeah. One other thing I've done occasionally is used EFT Master pulled inches analogy of the color of pain and have people describe the pain in great detail. And it's interesting, I've never yet had somebody say, I don't know, when I ask them the color of their pain. And sometimes they'll give you these elaborate explanations. It's this golden, glowing yellow ball with red streaks shooting through it and little turquoise spots and little black rays popping out from it. It's like, wow. I don't know what any of that means, but I know it's highly meaningful to the client. And so you ask them to describe it, you then do some tapping, and it's amazing how it usually then starts to shrink, starts to change color, maybe it starts to vibrate, maybe it becomes translucent, and all of these other kinds of shifts occur in the ideation, in the conceptualization they have of the pain. And often just tapping on the color of pain seems to help people shift.
Mm-hmm. Yeah.
Yeah, you know what, it's funny, I'm much more of a left brain person, and so that's never been my personal favorite. So while I ask that, I tend to shy away from that because I'm one of those few that will say I don't see an color around it. So I'm one of those few, so I tend to not ask that as readily and get more information from other questions. But it's certainly one of the things that I think I'm careful about, and maybe it's because I'm sensitive to it, is I will throw out a lot of different qualities and allow them to choose. So I don't say, okay, what color is it? Yeah. What does it bring you up? Because there's a pressure that builds up in that moment. So I'll often throw out a variety of things. Tell me about what it feels like, what it looks like. Is there a color? Is there temperatures? And so that they can really feel the ease of picking and choosing which ones come to them. And I think that that's something that I'm always sensitive and careful to not make them feel pinned in like they have to answer one particular question a certain way, and I think that's important too.
Like, is it a dull pain or sharp pain, for example?
Absolutely, yeah. Another thing I think is very important is, like Craig said, the loss of the pain, but I feel it's very important to also look at the benefit of the pain.
Yes. I hadn't gotten it.
Yeah, because very often, the pain, all of a sudden, even they don't like the pain, but all of a sudden they have all the attention they didn't have before, and people take care of them. They don't have to go back to work, or they have their disabilities. So that also is something to address carefully. Because in the beginning people say, oh, what are you talking about? Of course I don't want the pain. But at one point, like with gentle guidance, they will go there. And I've seen tremendous transformations once that is cleared.
Yeah, thank you for that careful and cautionary secondary gain issue.
Yes.
Right, because you want to create this disconnection with a client. The first thing you're going to do is, what are you getting out of this? Right?
Yeah. Not really. No, that doesn't work too well.
But it's always fast. I always love when it shows up organically from a client. I was just working on one that's a veteran, and he kind of cocked his head, and he's been dealing with a lot of shame and regret and guilt, and he said, you know what? I think he goes, this is going to sound really weird, but I think the idea of not having that anymore, I'm not so comfortable with that. I'm really kind of comfortable living with this. It's been a long time.
Absolutely.
And it's so beautiful when they have that realization and you don't have to point that out. I find that always much more powerful.
And sometimes a long pain can be an old friend. Who would that be without it?
Right.
Yeah.
Yeah.
Yeah. And so you have to be prepared to draw out the sense of self they might have without it, and give that part of their experience of voice as well. So who would you be if that pain weren't there? In Byron Katie's 4 questions, that's her 4th question. Who would I be without this story? Who would I be without this symptom? Who would I be without this pain? And that there may be something scary there, there may be something empty there. So what might there be if you no longer were characterized by this issue that's been part of your identity, sometimes for years or decades?
You know, it wasn't a pain issue, but it was just a client today, and I love the way that it came out, was the familiarity with the person punishing themselves over things from their past. And after a round of tapping, there was like this inner silence. And the only way that the person knew to interpret the inner silence was with a negative quality, like, I guess I'm just numb, I don't feel anything. And in a reframe, started to look at that it was just neutral, it was just quiet. But they're so accustomed to being used to the negative thought patterns and the self-attack and the self-deprecation that they didn't recognize the neutralness of just silence and quiet in their head. And so sometimes they've got to reframe or rename sensations that they're not used to having when they start to get rid of their pain and things associated with that.
Yeah, one of the things that has struck me is how some people I meet are really uncomfortable with the silence in their head. Personally, I'm kind of a hermit. You know, if I could have my druthers, I'd just be living in a little cottage in the woods, meditating 4 hours a day, and you know, saying, waving at somebody in the supermarket once a day as my social interaction. But what I find is, so while I prize silence, I tend to project that onto other people, and that's often not true. Like I know I have friends, I've met friends who have to have the radio or TV on all the time. When they come home from work, they turn on the TV immediately. When they wake up in the morning, they turn on the TV immediately. So the silence in their head is something they feel really uncomfortable with, and they can get agitated or even have a panic attack when there's no external information flowing to them. So there can be secondary gain there. That this is secondary gain we're talking about here. That's the term we use in EFT is secondary gain. When you gain something from having the pain, or the pain is filling up some part of your life, you might feel uncomfortable looking at if the pain were not there.
Absolutely.
Yeah. Craig, there's one video on EFTUniverse. We have a lot of tap-along videos. We've actually just reorganized that whole tap-along video page. And one of the funniest tap-alongs there is a woman who had chronic pain, I think for 10 years, in her foot, her left foot. And we'd done a bunch of tapping on emotional issues. I'd used the color of pain. And she was down to like a 2. And she had 10 years of foot pain. It was always around a 6. It was down to a 2. And but the pain won't go any lower. And I'm pulling all of my best stuff out of the bag and using it on her, and just pain's a 2. It's clearly not going to go away. So eventually, I think, well, it's really clear. EFT has done its magic. We dealt with the emotional stuff. Pain's down to a 2, which is a pretty good result. Just leave it there. And then I thought to myself, but imagine if the pain weren't there. I don't believe that pain can go away. I really don't believe that pain can go any lower. So I said to her, I just blurted this out, I honestly don't think the pain can go any lower. So let's tap on that. I don't believe the pain can go any lower. So we're both sitting there tapping away and just convinced the pain won't go any lower. She's convinced the pain won't go any lower. I'm convinced the pain won't go any lower. And I asked her, what does the pain, that 2 in your left foot, look like? And she said it's a big, hard blue ball. And so we tap, even though there's this big hard blue ball in my left foot, never going to go away. It's there forever. May even get worse, may come back, blah, blah, blah. You know, I said, well, tell me about the blue ball. She said, well, it's not really a blue ball anymore. It's now like a gray mist around my foot. Gray mist, better than a dense blue ball. So we tap on that. That'll never go away. And then she's like, the pain's gone away. And it's such a funny video because I'm like, are you sure? I don't believe it. And the whole room doesn't believe it, and she doesn't believe it. So we all looked really foolish in that video, but it was a really fun time as well.
It's a beautiful example of being present and not bringing a preordained technique to the moment. You know? Because as things, sometimes words or questions come through us when we're really being present, we create new questions and we create any one individual in a healing relationship. So I think we need to really honor those moments because they're just
full of surprises.
I was going to also, you know, there are, but what you speak about are the beliefs around the pain, like of course Claudia was saying, and that was a small one there, is, you know, whether EFT can help, but it can't make it totally go away. Or, you know, that there's, okay, I understand that there's stress, but there's still a physical bunion there, or a heel spur, or whatever. And, you know, I always look at, when I first started to play with a lot of different mind-body techniques, and I felt at a disadvantage having had my chiropractic and medical education, because when I'd be around more esoteric, energetic techniques, somebody that had no education could say, great, poof, I did that work, their heel spur is gone, see? And in my head I'm going, a heel spur doesn't just go away like that, it's a calcium deposit, you know, and I had a lot of rationale and understanding scientifically why something was so. So to have something just dissipate in a moment was a bigger leap of faith for me. So it took a while to start to let go of that, and then, you know, it's a perfect timing with Dr. Joe Dispenza's book coming out now, is looking at placebo. I don't like the word, I like the concept, that when we look at what is the responsibility of a practitioner for hope, for the possibility that anything can be accomplished without making that promise, we have to hold that space. We have that responsibility as a practitioner to hold the space for complete healing to happen in without being attached to the results. And then a recipient can step into that space, and all things are possible. So the responsibility of the practitioner to get rid of their own beliefs, limiting beliefs, is as critical as working with the client's beliefs, I think.
Absolutely.
So let's hear from you about more stories and also more ways in. And just again, imagine the people listening and the people who will be listening to this on the replays. And a lot of them are choosing this video to listen to because they have pain. So let's just walk them through what you might do. Maybe you can go first, Claudia, by way of a practical set of steps that they can use to approach their pain and dealing with their pain and applying EFT to their pain.
Yes, I would like to share an experience. It was my personal experience. And I always knew EFT was fantastic for chronic pain, but I had never applied it on acute pain. And then a couple of years ago, I closed my car door and I forgot to take my finger out. And I broke my finger, and it was an open fracture. It was really, really bad, and I was rushed to the hospital, and they put me right away into a wheelchair. And they gave me painkiller. Nothing worked. And at that time, something just told me to tap. But I did not do the setup. I didn't say, like, even though I just broke my finger, I accept myself. I could not do that. But I was so totally tuned into my pain. So I was just tapping the points, and I was tapping the points, and every time a new wave of pain came, I was tapping on my points. And at one point, I mean, we all know EFT looks a little bit odd. So at one point, my husband says, if you don't stop doing that, they'll put you into another ward. I know, but I don't care. You know? To make a long story short, I think I was in the emergency for about 4 hours, and they sent me home with a big bottle of Percodon or Percocets, and they say take 8 pills a day because you will have a lot of pain, and keep your hand, keep it high so it doesn't throb. I had no more pain. I just fractured my finger. I had no pain. The only time when I felt a little bit of pain was when I, by accident, bumped my finger, and it was a fracture. Of course, that was sensitive. So what I want to tell the people that are here on the call is, when you are in an issue and you just hurt yourself, don't even think of what to say. Just tap. Keep tapping, keep tapping. You're fully tuned into your issue, and balance your energy system, and you will release the pain.
Yeah, the purpose of the setup statement is to get you tuned into your issue.
Exactly.
When you're in pain, you're plenty tuned in already. So
exactly. Yeah. And when you're in a lot of pain, you probably can't even think of setup. There was no way I could say a setup phrase. I was in too much pain, but I was able to tap, and it healed beautifully. It was perfect. So that was, yes?
There are so many of those stories, Claudia, on EFTUniverse, and we collected a whole bunch of them into this little online course called EFT for First Aid. And it has just dozens of stories of people who, like one woman who stepped on a bee, and again didn't use the setup statement at all. So she had this bee sting on her foot, on her heel, where she stepped on the bee, and it was swelling and red, and so on, and it was painful. And she just began to tap, and within just a few moments, the pain went away. Another doctor had given a man, and one of his older patients, he'd given him a flu shot, and the story is called "The Flu Shot Gone Wrong" by Dr. Charles Gebhardt, and he says how the next day the guy came up and he had this allergic reaction. He had this egg-shaped bump on his arm, and he began to tap with the patient, and then the bump just went away before his very eyes. He ends his story by saying, "Nothing in my medical training prepared me for rapid healing like this. This is just completely out of the box." And it's not just, if there are 3 of these stories, it would be like, wow, that's weird. When there are 100 of them, it's like, okay, let's start to pay attention. What can we learn here? And when the first thing you do is EFT for first aid, like your first aid kit, run for the Band-Aid, make sure you get the antibiotic if you need it, but do the tapping, because you might find that things just heal far more rapidly than you expect when you apply that to that pain immediately, like you did in that story.
Yeah, or when you have a severe reaction, like an anaphylactic reaction. Okay, go to the hospital, but start tapping on the way to the hospital.
Yes.
You may feel much better once you're there.
Yes. Even things that seem purely physical, like your bone fracture.
Sorry?
Even for things that seem purely physical, like your bone fracture. Because again, if you look at the emotions there, you're probably angry at yourself for closing your car door on yourself. Maybe you're in a hurry. Maybe you weren't paying attention. So you have that kind of self-talk. Oh, I'm such a klutz. I did this, and I wasn't paying attention. Maybe I had self-talk going. What if it gets worse? What if it gets infected? Oh, what if it gets infected? Oh, no! They get infected. What if the
and the blood ruined my beautiful sweater.
the blood ruined my beautiful sweater. Right. What if I pick up an antibiotic-resistant strain of infection in the hospital? Hospitals are a great place to pick up antibiotic-resistant bacteria. What if they go to my brain? And
exactly. But not only that, Dawson, like this whole shock distorted the energy system.
Yes.
Okay, so when we just tap, we straighten out the energy system and we release the shock, so the pain goes away.
Yes. And so you're feeling that sense of shock, and then you tap. And what that does is that I find that feeling of shock, that sense of shock, rapidly diminishes.
Just melts away. Yes, exactly.
And if you don't have that, then that sense of shock can kind of settle in your body. I know I was once rollerblading, and I was rollerblading down this path, this concrete path here in Santa Rosa, and there was a woman walking toward me with a little child, like a grandmother and a little child and a dog. And I was doing about, when I rollerblade, I can do up to like 40, 50 miles an hour. So I was going pretty fast and the pedestrians are supposed to move aside. So, very intelligently, the grandmother took the little girl, moved her to the side of the path, and the dog trotted off to the outside of the path, leaving the leash strung taut between them.
Oh my God!
Like a tripwire. And I just went right into the... and I thought, either I can hit the grandmother, I can hit the tripwire, I can hit the dog. Now, I got to say, I made a conscious choice to hit the dog. I thought at least the dog's going to break my fall, so I aimed for the dog, hit the dog, went somersaulting head over heels over the dog into the grass on the side of the concrete. So the dog cushioned my fall a little bit, and I landed in the grass. But I was really shocked and shaken. High speed collision, and the woman was beside herself that her dog had caused this accident and so on. But I just got up. I began rollerblading again after I'd assured them I was okay, and I didn't check for broken bones. I didn't check for anything. I just tapped and bladed. I just kept on going. Because I feel that shock setting in, that and I didn't want to go there. I just wanted to tap, release it, and move on. And within 5 minutes, I was fine again. So that sense of shock can by itself be a real problem unless you shift that and release that.
It's like the freeze response doesn't settle in. It just moves out. Yes.
Yes. Moves through you. Yeah. So what's an example of a client where you might then conclude they need both EFT and some of that supplementation? Like, I take supplements, and I'm always looking at which ones I'm taking, whether I'm just taking stuff out of rote or belief, or whether I really need it. But obviously, sometimes you may need support in one part of your spectrum of biological resources or another.
I will give you an example of a beautiful little 4-year-old. And she came to me with Lyme disease.
Right.
And it was like the first time I had to tap on myself. She looked like a pain-ridden 80-year-old woman in a 4-year-old body. And we did tapping. But I also, it was not so much supplements. I prefer to take things out than putting more things in, because very often it's the wrong diet. A lot of people are very, very sensitive to gluten, to any kind of grains, to sugar, to dairy. So I prefer to, I put my clients, when they come with chronic diseases, I put them on an anti-inflammatory diet.
Yes, that's a really good one.
Yeah, and then we see if we need to build up the adrenals or things like that. But I find when they are on anti-inflammatory diet, a lot of stress is already taken away, and then with the tapping, the body regenerates itself. The body has the wisdom to heal itself.
Yeah, you don't want to be tapping and then still subjecting your body to an allostatic load, to an overload of substances that don't agree with it. So tapping isn't like your free pass to eat rubbish that's going to hurt.
No, it helps a lot, but if you don't take charge of your life, and then maybe you need to tap. So okay, why can't you give up sugar? Or you can tap on sugar craving, and then also why don't you honor yourself enough not to give up the substance when you know it makes you sick? So it's just wonderful. It goes on and on.
Yes, absolutely, and it is wise to make the full spectrum of help available to yourself, whatever it is. So it could be diet, could be nutrition, could be supplementation, could be medical care, could be a prescription, as well as taking care of the emotional stuff that often is adding to the stress level and skewing the whole picture. So we only have about 7 minutes left on the call, and I'd just love to hear from both of you briefly. Perhaps you first, Craig. Any closing thoughts to people in pain? Resources they should be aware of, questions they should ask themselves, approaches they might take to using EFT?
I think that, like we teach in all our trainings, I think it's stepwise what they're ready for. So if it's brand new to them, they just need to develop some beginning confidence on tapping on the symptoms that they're feeling. And it's just a full acceptance of what's happening right now, right? So in other words, I'm feeling this sharp shooting pain that's wrapping around my ribs, and it hurts when I bend. And we just really allow a patient or client to be really present with what's happening. And that's a witnessing, it's an acceptance, it's a mindfulness aspect, it's an energetic tapping, all of those. You then progress into, of course, what we know the emotions underlying that. So we start tapping into resulting emotions and then ones that may have been causative or before. And ultimately that leads us to those things that, just like every other condition, kindled our way up. In other words, we're there before. So when we start to follow that daisy chain of what this feels like, what it reminds me of, the first time I ever had this. And, the one caution that I would say is that as a person starts to move closer and closer to bigger traumas and things that are really big, and most people, I think, will start to sense, you know what, maybe I shouldn't do this myself, it's time to work with a practitioner or a coach, that there's a gray line sometimes where somebody can help themselves but maybe not get rid of it. And just to know that if they weren't able to get rid of all of it, it wasn't the fault of EFT, or it wasn't that they did it wrong, they just got a chunk of it out, and it's great to know that they can use that for themselves. And then there are absolutely times when a practitioner is going to bring a secondary perspective that brings a lot more resources and a lot more experience to that. So I'd say to just know that there's a continuum there.
Yes, good. And I'll go ahead and recap at the end of the call in a moment or two about all the free resources on the website, as well as our workshops, classes, books, and so on. So I'll make sure I mention all of those are relevant to pain. Claudia, your final thoughts for people who are grappling with this issue?
Well, Craig said it very well. What I tell people, tap on your pain 10, 20 times a day. Like even though I have this pain, I accept myself, and then the subsequent rounds, even though I still have this pain, and you go through the points, remaining pain, remaining pain, remaining pain, and then one more time, and do that whenever you think of it. And it will create wonders. I've seen them. And another thing I always point out to my clients is, okay, the pain is gone, but it may come back. And I tell them not to be discouraged. I make it very clear, when the pain comes back, it doesn't mean it didn't work. It just means another aspect came up. Like in a specific event, we can have sadness, we can have anger, we can have guilt. And the pain is just an expression of different emotions. So it just means there's more to do, and keep on tapping on it. Yeah. And I invite my clients also to do the personal peace procedure. I explain to them that is the biggest gift they can give to themselves. And to start tapping on the little T's. But like Craig said, don't address traumas, big traumas, by yourself.
Yeah. And again, the personal peace procedure you can find described in the EFT manual. Mm-hmm. You can find it described on the EFT website. We cover it in the last module of the Level 1 training. And also, I'd encourage you to take a Level 1 and 2 training with one of our certified trainers. There they will show you how to use EFT step by step by step. And what you'll find is that there are many different components to the technique. And if you learn each one solidly from the ground up, you will wind up with a phenomenally effective synthesized toolkit in your EFT practice. So we'll make sure that piece by piece you maximize all the possibilities of EFT in our training. So please do take an EFT Level 1 and 2 workshop. And again, there are over 100 trainings all over North America, all over the world, and I really encourage you to go ahead and do that. Also, do work with a practitioner. There are over 300 certified practitioners on our website. They are all certified in clinical EFT, so they've gone through this rigorous training. They have demonstrated their ability to work with clients. They passed exams. We have regular re-examinations for them to make sure they keep the knowledge current. And we have a lot of confidence in those people on the website. If they are on the website, that means they know what they're doing. So I'd urge you to avail yourself of a practitioner.
Dawson,
yes.
If I just might add one thing, I'm sure you see that. I'm sure you both see this. That so many people that come, I mean, that come to trainings, have found EFT somewhere online from a friend, and have thought that they knew how to do that, and then for whatever reason they realize they need to learn more, and they come to a workshop and they get supervised and they get feedback, and they realize all the mistakes that they learned, and no wonder it wasn't so effective. They're just, I know I'm a trainer, so there's a vested interest, but I just can't tell you there's not a workshop in which people don't, every person doesn't just get, oh my God, I wish I had known that before. If only I understood, if I only knew I was doing that, if I only knew to say that there's really no way to replicate a one-on-one experience, that even online with the best of teachers.
Yeah, often people say...
Absolutely.
Yeah. They'll say, oh, I learned EFT 10 years ago, I've been using it for many years, but wow, until I took an EFTUniverse clinical EFT level 1 or 2 workshop, I was missing most of the pie. So that's a common comment of people, that they didn't realize this or that component of EFT, and they've really limited their abilities by not knowing those pieces. Right. Also, there are lots. Go ahead, Claudia.
What I noticed in students that have done EFT many years ago, and then they did the clinical EFT with EFTUniverse, and they were just so impressed by the theory we teach them, like how EFT affects the hormones, that the cortisol is going down from a few rounds of tapping, which is key for self-healing, and also how we explain how the sympathetic and parasympathetic nervous system affects all the organs. So it's a big gift to do the workshop, to learn how to actually apply it, but also the background of EFT.
Yes, it really helps to know that background and know where EFT came from, and that it's an evidence-based, scientifically proven, validated method. It's not just something that, the structured approach we take is validated in many, many, many studies. Also, just free on EFTUniverse, there are many, many, many case histories, and the best way to navigate the site is to go to the little pull-down menu that alphabetically lists the problems you use EFT for. Like, for example, Claudia, you'll find on the fibromyalgia hub. So if you go to fibromyalgia, you'll click on that. That one central hub will give you then links to all of the spokes that radiate out from the hub. All of the resources to do with fibromyalgia radiate out from that one central hub. So go to a hub, choose your problem that way, and if it's pain, from the pain hub, you'll find videos, you'll find books like EFT for back pain, which just got revised last year, which is a really good book. There are links to videos where you can just tap along, watch the video for free, sit there, find a pain video, tap along with that person, and borrow benefits. You'll experience that your pain often will go down as you tap along with somebody else on the screen. So there are tons and tons of resources, everything from a $10 book on Amazon to a full-fledged workshop to all the free pages on the site to that simple online course called EFT for First Aid, which is full of stories of people who've used EFT for pain and other kinds of problems. So the only wrong thing to do, the only bad thing you can do following this program is do nothing and suffer. Yeah. That's all you don't want to do.
Right.
Whatever you do, don't think that pain's inevitable. Don't think that pain is going to get worse. Don't think that pain can't budge. You'll be surprised how big the bigger component the emotions are in physical pain. In one study of 216 healthcare workers, like alternative medicine practitioners, doctors, nurses, psychotherapists, we looked at their psychological issues as they took a one-day EFT workshop at a medical conference. And we found that their psychological triggering, things like anxiety and depression, dropped by about 45% in the course of that one-day workshop. That's a huge improvement in psychological symptoms from one-day workshop. But he also did a 30-minute pain segment in that workshop, and the average drop in pain was 68% in those 5 groups. So big drop in pain, and that 2/3 drop in pain was due largely to the emotional component of pain, like the stories we shared with you today. So we know from our research that over and over and over again, a huge component of what we think of as physical pain is really emotional, and tapping is the way to address that. So again, don't suffer, don't think it's inevitable. There's an amazing amount of benefit you can gain from trying EFT. I'm also so appreciative of you, Claudia, of you, Craig, your wonderful work, your passion and caring for people that shines through your faces, your words, your voices, and your work. Thank you both ever so much.
You're welcome.
Thank you, and thank you for
Thank you for having us, Dawson.
Yeah, thank you for having me. My pleasure. Thank you.
Okay, and